these declines appear now to be leveling off, or in some instances, increasing. Today, we're reporting 1,088 new cases. The average number of daily new cases reported over the last 7 days increased to 878 new cases. That's compared to an average of 660 new cases we reported the prior week. This is about a 33% increase in our case numbers. And our average 7-day average daily case rate also rose a little bit to about 9 new cases per 100,000 residents, again, reflecting that increase. Test positivity, though, remains low at about 1%, and our COVID-19 related hospitalizations have also remained stable, with fewer than 300 hospitalizations reported each day this week. Today, there are 273 people are hospitalized with COVID-19 or for COVID-19 in LA County. Thankfully, our daily deaths declined to an average of 13 deaths reported each day for this week. And that's compared to about an average of 17 deaths that were reported each day about a week ago. This decline is, of course, a huge relief. But I know that each of these losses has profoundly impacted the lives of people who have loved those who passed away. And I want to extend my sympathies and wishes for strength and comfort to each person that's grieving the death of somebody they loved. Next slide. This slide shows the trend lines for the 7-day average daily cases by report date. The green line, that's what you're seeing there. The 7-day average daily hospitalizations by admission date, a little bit of a different number there. That's the orange line. And the 7-day average daily deaths, again, by report date, that's the blue line, over these past 4 weeks. You can clearly see that cases were declining until late March, when they leveled off and then began increasing in April. And it's important to note that with the increased accessibility of home kits, the test results that are reported to public health and shared with everyone are an undercount of all of our positive cases. Since March 6th, when there were an average of 100 daily COVID-19 related admissions, hospital admissions have been declining. On April 6th, the 7-day average daily hospitalization admission dropped to 30. Finally, as I noted, the average daily number of deaths has declined significantly. Just as a reminder, back on March 6th, we were still reporting about 51 deaths a day. We're so relieved to actually have that down to about 13 deaths. Knowing, of course, that every life that's lost is a cause for grief and sorrow. Next slide. Each week, we do report out the daily number of deaths from COVID-19, and our reports also note the total number of lives lost since the beginning of the pandemic. Another way to capture the devastating consequences of COVID is to look at the overall all-cause mortality rates in LA County in 2020 and 2021. This measure captures the rate of death from all causes, that's including heart disease, cancer, respiratory illness, injuries, as well as everything else. This slide shows the overall trend in all-cause mortality by race and ethnicity back from 2011 all the way through 2021. Before reviewing sort of the findings that you can see here, I just want to make note of 2 caveats. First is that the data that's reported for 2020 and 21 are what we consider provisional because they don't include death certificate records for LA County residents who died outside of California. Now that's a relatively small number, but I want to note it's not included in this. In addition, for this analysis, COVID-19 deaths are defined only as those that listed COVID as the underlying cause of death on the death certificate. This is different from our more inclusive ability to capture COVID-19 deaths using data from other sources, including deaths that are reported by facilities, the coroner's office, through interviews, and through our outbreak reports. So I want to note that the numbers aren't an exact match here. But as you can see in LA County, sadly, the all-cause age-adjusted mortality rate, that's shown in that white line, which was relatively flat from 2011 through 2019, Really, as you can see, the death rate increased substantially in 2020 and 2021 for the entire county population, as well as for all 4 of the racial and ethnic groups we're reporting on here. In 2021, the all-cause mortality rate was highest for Blacks, that's the green line at the top, and Latinx residents, shown by the pink line, with rates exceeding the rate for the overall county population. Again, that's that white line. The all-cause mortality rates, as you can see, were lower for both white and Asian residents. Asians, shown by the orange line, had the lowest all-cause mortality rate. Notably, you can see here that in 2020, while the disproportionality between racial and ethnic groups continued, for the first time, the all-cause mortality rate for Latinx residents surpassed that for white residents. For each group except Latinx residents, there is a slight decline in 2021 when compared to 2020, although the age-adjusted mortality rate for all the groups was still significantly higher than during the pre-pandemic period, as you can see on this slide. We'll take the next slide. This all-cause age-adjusted mortality rate for the overall county population actually increased by 23% from 2019 to 2021. While Blacks experienced the highest all-cause age-adjusted mortality rate in absolute terms during this period, the relative increase in the mortality rate in 2020 and 2021 compared to 2019 was highest by far for Latinx residents. When compared to 2019, all-cause mortality for Latinx residents increased by 42% in 2020 and 48% in 2021. By comparison, all-cause mortality for white residents increased by 11% from 2019 to 2020 and 7% from 2019 to 2021. The sad reality is that we've borne witness to this disproportionality in the ongoing reporting of deaths associated with COVID almost since the very beginning of the pandemic. Next slide. It is important to note that the excess deaths we saw these past 2 years include both deaths from COVID and deaths that happened from other causes. This slide shows the number of excess deaths that occurred in 2020 compared to 2019, as well as the proportion of those that are attributable to COVID-19 illness. In total, there were over 16,500 excess deaths in LA County in 2020 compared to 2019. And while COVID-19 accounted for most of the excess deaths that occurred in 2020, there was significant variation by race and ethnicity. And I want to note that the numbers will, of course, be higher for 2021, but we haven't completed the full analysis yet. COVID-19 accounted for about 2/3 of excess deaths in the county overall, and for about 80% of the excess deaths that occurred among whites, 70% of the excess deaths that occurred among Latinx, 60% of excess deaths that occurred among Asians, and about 50% of the excess deaths that occurred among Black residents. This variation in the percentage of excess deaths attributed to COVID-19 could be because of several reasons, and it's most likely due to a combination of factors. Some explanations may include differences in access to healthcare and health-affirming resources, differences in access to testing, differences in the distribution of chronic diseases, as well as differences in the experience and impact of stressors, which could lead to worsening of chronic health conditions. Public Health, of course, is conducting some additional analysis, so hopefully we'll be able to come back with a better understanding of what's accounting for these differences. But together, the findings from these 3 slides are a somber reminder of the terrible toll that COVID-19 has had on communities across the county and of its disproportionate impact on certain groups, including Black and Latinx residents. We're hopeful that with highly effective vaccines and boosters and increasing access to several therapeutics that reduce or prevent severe illness for people infected with COVID-19, we'll see fewer deaths from COVID-19 in 2022 and beyond. In order, however, to close the racial and ethnic gaps in mortality, we'll need to not only significantly increase use of the protections, vaccines, boosters, and therapeutics, we also need to ensure that Black and Brown residents have the health-affirming resources that are needed for optimal health. This includes good paying jobs, protections at work sites, affordable and healthy foods, safe housing and safe neighborhoods, and high quality, accessible healthcare. Health affirming resources that actually we all need as well. Slide 6, next slide. In addition to paying attention to our customary metrics, including deaths, we do continue to monitor our CDC community level rating, which is a measure of severity of disease and strain on our healthcare system. As you can see on this slide, our overall community level, based on CDC's metrics, remains low this week. The case rate for the past 7 days is the first indicator used by the CDC to determine our community level, and they combine that with 2 hospital metrics. As of today, LA County's case rate is 55 new cases per 100,000 people, which remains below the CDC target of less than 200 new cases per 100,000 people in the last 7 days. The first hospital metric that determines our community level is the 7-day cumulative rate for new COVID-19 hospital admissions. Today's rate of slightly over 2 admissions per 100,000 people meets the CDC criteria for the low community level. The second hospital indicator is the 7-day average for the proportion of staffed inpatient beds that are occupied by COVID-19 patients, and that's slightly under 2% for LA County. This is also considered to be in the low community level. While our community level is low, reflecting little strain on the healthcare system, as I will note next, we're starting to detect some areas of concern in our system of early alert signals. Go on to the next slide. Because our community level primarily reflects strain on the healthcare system, we're also, as you all know now, monitoring a set of community-wide and sector-specific indicators that can serve as early alerts that maybe cases, outbreaks, hospitalizations, and/or deaths are starting to increase or could start to increase. The 3 community-wide early alert signals are related to variants of concern, COVID-19 related emergency department visits, and case rates in our lowest income communities. The 4 sector-specific signals relate to outbreaks in each of those sectors. When an indicator suggests a possible area of concern, we consider opportunities to strengthen our preparedness efforts, to refine or implement additional protective measures, and to encourage residents to take sensible steps to protect themselves and others. As you can see for this week, all of our early alert signals are of low concern except for 2, which we'll take a closer look at. The first is the percentage of specimens sequenced that are identified as a new variant or subvariant of concern, which, with 47% of recently sequenced samples in LA County identified as BA.2, this has now reached the high concern threshold. The second is the number of new outbreaks in TK through grade 12 classrooms. With 14 classroom outbreaks reported in the prior 7 days, this measure signifies moderate concern. We'll go to the next slide. Before talking about school outbreaks, I do want to provide the latest sequencing results. As you can see from this slide, Omicron continues to be our predominant variant. It's accounting for 100% of all the cases with sequenced specimens that were collected in the week ending March 19th. Although BA.1.1 remains, as you can see, the predominant lineage, the proportion of cases that are caused by BA.2 continue to increase. And for the week ending March 19th, BA.2 accounted for 47% of sequenced specimens. Since these data represent sequencing results for specimens that were collected actually more than 2 weeks ago, we're pretty confident that this likely underestimates the proportion of COVID-19 cases that BA.2 accounts for. Given that BA.2 is more transmissible than the earlier strains of Omicron, it's very likely that BA.2 is now the predominant subvariant in LA County. The XE recombinant, a combination of the BA.1 and the BA.2 subvariants that is circulating at low levels in the United Kingdom, has not yet been detected in California. We're closely following any findings from the World Health Organization, the CDC, and other agencies regarding this variant, and we'll be considering any possible public health implications for LA County. But I want to reiterate, we have not seen this variant this subvariant in California. Our pattern in LA County does mirror what we're seeing nationally and internationally. Worldwide, BA.2 accounts for the vast majority of sequence cases. And in the United States, the CDC estimates that as of April 2nd, BA.2 accounted for 72% of sequenced specimens in the preceding week. Because BA.2, as I noted earlier, is more easily transmitted than BA.1, it can easily contribute to increases in cases. And as we're starting to see increases in our cases in LA County, we will need to take some sensible precautions and strengthen our preparedness efforts, which I'll briefly discuss in a minute. Next slide. The increase in school outbreaks, while the number is relatively low, is concerning because it represents increased transmission of the virus in school settings. As you can see on this slide, with 12 elementary schools and 2 high school outbreaks reported in the 7-day period that ended on April 5th, we've more than tripled the number of new outbreaks at schools this past week. And we're seeing similar numbers of outbreaks to what we experienced during the Omicron surge. Furthermore, we're seeing a higher number of cases associated with the recent outbreaks. For instance, there's one active high school outbreak which opened with 26 what we call epi-link cases, people transmitting to each other, which has since grown to 60 cases in that one school. This increase in outbreaks likely reflects increased circulation of the more easily transmitted BA.2 variant, as well as the lifting of indoor masking requirements at schools, as well as the change in the state's quarantine guidance that no longer requires asymptomatic students remaining in school during their quarantine period to wear masks and be tested. Next slide. With the continued tracking of testing results at schools, we can see that the increase in outbreaks is not associated with an increase in either test positivity or the number of cases at schools. This slide shows school testing volume represented by the blue bars and test positivity represented by the purple trend line over time. As you can see, the test positivity rate has continued to decline since early January. Between March 29th and April 1st, over 422,000 tests were administered, with a test positivity rate of much lower than 1% at 0.15%. Next slide. And this next slide, you can see since our initial post-surge declines, we've not seen an uptick in cases among staff and students in elementary school, middle school, high school, or youth sports. For the week ending April 3rd, there were 91 positive cases among staff and 327 positive cases among students. This is for the entire county. Next slide. We're grateful for everyone at schools, doing their part to minimize COVID-19 transmission and to create the safest possible environment on campus for students, teachers, and staff. And we thank everyone for their efforts. However, with the increase that we're seeing in outbreaks, we're asking schools to be sure they're taking the following steps to reduce transmission. Indoor masking remains a very, very strong recommendation. This is especially true since in other high-risk settings, such as nursing homes and shelters, where masks remain required, we have not yet seen any increases in outbreaks. Additional actions schools are asked to take include improving ventilation wherever possible, monitoring staff, students, and visitors for symptoms, conducting response testing of persons with an exposure and/or with symptoms, isolating cases by not having them come to your campus, and requiring a negative test to return to school for shortened isolation periods. A very strong recommendation that exposed students who are remaining in the school during their quarantine period are in fact required to test and to stay masked, and a strong recommendation that schools, where resources allow, offer routine weekly testing for students who are not vaccinated or fully vaccinated. Fortunately, given the uptick in cases across many parts of the country and the world, as students and their families return from spring break, the LA County Office of Education has partnered with the state and public and private schools to be able to distribute at-home test kits so that all students can be tested before coming back on campus after the break. As always, schools are required to report cases and outbreaks to the Department of Public Health, and our public health team works closely with all schools that are experiencing outbreaks to ensure that steps are being taken at these schools to reduce transmission. Should we continue to see increases in the number of outbreaks at schools, we're going to work with our school partners to determine what additional safety measures are warranted. For those schools that experience on-site transmission, as always, public health may require changes in safety protocols during an outbreak. These measures can include more stringent guidance for masking and testing, particularly for those that have been exposed. In addition to requesting that schools institute all of these recommendations, public health is supporting efforts to increase vaccine and booster uptake with the continuation of mobile vaccination clinics at schools. This week, there's 238 mobile vaccination clinics that are located at school sites. As we've seen, outbreaks are more common in the lower grades, where there are often much lower vaccination rates among the younger children. Because of this, there are also many partners that are working to ensure that parents and caregivers have information about vaccine safety and they're able to get answers to their questions. We're urging everyone interested in supporting safety at schools to review the TK through grade 12 toolkit for schools and resources for parents that are posted on our TK through grade 12 schools webpage. You can find that, as you see, at ph.lacounty.gov/education toolkit TK12. Next slide. Given the unpredictability of the SARS-CoV-2 virus, we do need to remain well prepared for any challenges ahead that could require additional safety and mitigation strategies. As I previously shared, we're tracking our progress among 13 key metrics that assess our preparedness capacity in the areas of outbreak management, testing, surveillance, vaccinations, and therapeutics. You can see our preparedness levels for each of these metrics on these two slides, this slide and the next one. And this dashboard, I just want to remind folks, we do post it and it's updated once a week on our website. Public health is working hard to ensure that in each of these areas, we're well prepared for future surges, new variants of concern, or any other challenges that pose a risk to the county. Today, I'm pleased to share that our preparedness is adequate or outstanding for every metric aside from one, the percentage of positive case specimens that are sequenced per week. Sequencing at least 5% of positive case specimens per week provides us with an adequate number of results to track circulating variants and contribute to our collective knowledge about the key characteristics of emerging variants, such as how transmissible they are, whether they cause more severe illness, and whether they're susceptible to vaccines and therapeutics. For the current reporting week, we fell just shy of sequencing 5% of positive cases, with 4% of positive case specimens sequenced. We're actively working to secure resources and partnerships so that we can increase the county's sequencing capacity. Next slide. Here you see that, similar to the previous slide, for the remaining indicators, preparedness levels for each metric is at adequate or outstanding. We do want to note that we closely monitor these week to week, and in all the places where we're just either adequate or we need improvement, we'll align strategies and resources so that we can ensure we have the appropriate level of preparedness to protect lives during the pandemic. Next slide. Last week, I reported on booster coverage in under-resourced communities using a calculation that was a bit problematic because it included in the denominator both those eligible and not eligible for a booster dose. This week, and I want to thank the team here that worked hard to get us a more accurate measure, we're able to actually assess the percentage of eligible residents 12 plus in the most vulnerable communities who have had one or more additional dose or booster. With this calculation modification, 53% of eligible residents 12 or older in the most vulnerable communities have received one or more additional or booster doses. However, as you can see on this slide, since more people are becoming eligible for rather than receiving booster doses during the reporting timeframe, we actually have a downward trend on this measure. The only way to avoid a continuation of a decline in the percent of eligible individuals boosted is to have many more eligible residents and workers get boosted. Otherwise, we end up actually needing improvement in this area. Next slide. Increasing the number of people who are up to date, obviously, on COVID vaccines, particularly in our hardest hit communities, therefore does really remain a top priority. And as we're celebrating our spring holidays, Ramadan, Easter, and Passover, often by gathering with family, friends, or other loved ones, if you're not fully vaccinated and boosted, you are at greater risk, and now would be a very good time to start your vaccine series or get caught up with any missing vaccine or booster doses. And the same applies to anyone who's planning to travel or to attend a gathering for spring break. This is especially important if you're at increased risk for severe illness, because you're elderly, immunocompromised, you have underlying health conditions, or you have a lot of exposures to others at work or in the community. While 75% of residents 5 and older in LA County are fully vaccinated, that leaves 1.7 million LA County residents 5 and older that haven't yet received their first dose. Another over 500,000 children under the age of 5 that also are not yet able to receive their first dose. And an additional 2.8 million residents that are eligible for the boosters but not benefiting from that extra protection, with booster coverage remaining disappointingly low in so many of our hard-hit communities. I want to note that there were findings that were recently published, I think on April 1st, in an MMWR journal that provide, again, compelling evidence of the importance of booster doses. Receipt of 3 doses of those mRNA vaccines, Pfizer or Moderna, provided 90% vaccine effectiveness against lab-confirmed COVID-associated hospitalization. And this is similar to our local data that shows that vaccines continue to be effective against infection and highly effective against severe illness and death, particularly if people are recently boosted. Given the importance of vaccines and boosters and the risk for increased spread, we do want to be sure that there's easy access to both accurate information and places to get vaccinated and boosted. Continue to work with partners who are able to provide residents with reliable information about the vaccines and the boosters through trusted sources. And they're also able to help link residents with places where they can get vaccinated. I want to thank our parent and student ambassadors. This program allows parents and students to take an active role in helping to stop the spread of COVID-19 in their schools and communities. And to date, we have over 1,600 parents and almost 500 students that have been trained as ambassadors. There are also hundreds of community health workers canvassing in under-resourced communities, able to provide information and schedule vaccination appointments for residents, with many of these health workers and promotoras conducting door-to-door outreach in priority neighborhoods, and they're actually able to vaccinate interested parties in their homes on the very same day. Across LA County, there's hundreds of mobile and fixed sites that offer free vaccines via appointment or walk-in. We're also providing vaccines and boosters at community events, pop-up vaccination clinics at community sites, and we continue to partner with schools and community-based organizations to offer vaccinations at schools. This week alone, there are nearly 700 mobile vaccination clinics. And fortunately, we have the ability to vaccinate people in their home if they can't travel to a clinic or a pharmacy to get those vaccines. As always, if you want to find a nearby location that offers free COVID vaccines and boosters, or you just want to learn about resources for yourself or for homebound residents, you can call the Public Health Call Center 7 days a week, 833-540-0473, or as always, visit us on the website at vaccinatelacounty.com or vacunatelosangeles.com. Next slide. Getting vaccinated and boosted, continues to be one of the most important steps all of us can take to protect ourselves and others from COVID. But there are thousands of residents that are still getting infected every week. Today we reported, as you know, over 1,000 new infections. So we need to ensure that when indicated, people who are infected have access to life-saving therapeutics. There are currently 2 oral COVID-19 therapeutics, Paxlovid and Molnupiravir, that are available in LA County, and both have been found to be effective against the Omicron subvariants BA.1 and BA.2. Both therapeutics are for use in individuals who test positive for COVID-19, have mild to moderate symptoms, and are at high risk for progressing to severe disease. Paxlovid can be given to individuals 12 and older, and molnupiravir to individuals 18 years of age and older. Each of these medications, however, does need to be administered within 5 days of your symptom onset and must be prescribed by a provider. As a way of improving access to what really is now a routine that requires a test, an assessment, and the medications treatment, the federal government launched the Test to Treat program in partnership with certain chain pharmacies, including CVS and Walgreens, to be able to provide testing, evaluation, and treatment all in one location. In addition, states and local jurisdictions like ours have also been identifying other clinical sites that can offer similar services. Test to Treat sites do need to offer services to people regardless of their insurance status or their ability to pay. Everything is free. They need to be able to either conduct a rapid COVID-19 test with the test results made available at the time of that visit, or to be able to evaluate an at-home testing result. There need to be healthcare providers available that can provide assessment about the relevant treatment options, and then the sites need to be able to readily dispense oral medications to eligible patients. This map shows the number of the current number of Test to Treat sites across our county. As of April 7th, there are 39 community sites, 20 CVS sites, and 11 Walgreens sites. We're continuing to work to enroll additional providers in this federal Test to Treat program, and we're hoping that as more therapeutics are available, our network will include a greater number of these Test to Treat sites so that it's really easy for residents to access these new COVID-19 therapeutics. I do want to note there are many more sites that are dispensing these therapeutics, and people are encouraged to talk with their providers, have their providers do the assessment, send a prescription to those pharmacy sites, and then the patients can access the medications that way as well. Beginning this week, though, knowing that in many parts of the county, as you can see on this map, there's just not a Test to Treat site that's close by, the Department of Public Health began providing Test to Treat telehealth services across the entire county to make sure that we're increasing access to therapeutics. Next slide. Residents that are having difficulty accessing care or medications can contact, can we get the next slide? Thank you. Can contact our public health call center.
Sorry, 1 second, doctor.
7 days a week from 8 to 8:30, as I noted, at 833-540-0473. The call center staff will answer questions and connect patients to services as needed. Those patients that are looking for a site where they can go for testing and treatment get referred to a Test to Treat site in the county, or they can be referred to a DHS, Fulton testing site, or one of the 3 DPH full service vaccination sites. That's at Market Street Center, Obregon Park, and Ted Watkins Memorial Park. Patients who already have a positive test result but need to access evaluation and a treatment will either be referred to a nearby Test to Treat center, if there's one nearby, or they can get connected to the DPH telehealth services. The DPH telehealth providers are clinicians that are available 7 days a week to screen patients for eligibility and determine which medication, if any, would be appropriate for that patient. Medications are then shipped to the patient's home overnight, or if the patient prefers, they can go to a Test to Treat center to get timely access. All of this is at no charge. DPH is also collaborating with Health Fauna and the 26 DHS Fulgent testing sites that are located in underserved communities to make sure that those patients can also easily access therapeutics. So for patients who test positive at one of these sites, they're going to get a text from Health Fauna letting them know that their test result was positive. And if they're symptomatic, they'll be directed to contact the DPH call center. These patients then will be routed for a telehealth visit with the overnight shipment of their medications. The same holds true for patients that test at one of the DPH vaccination sites who also will be routed for telehealth visits and then the overnight shipment of medications. Until there are more local pharmacies and providers that are enrolled and able to provide these test to treat services, access to the test to treat program through the telehealth service does fill a gap, and it does allow eligible residents to have more options so that they can, in a timely way, when appropriately indicated, receive those COVID therapeutics. In closing, while cases are increasing, so far the increase has not been dramatic, and thankfully hospitalizations are holding steady at a lower post-surge level. While it's easy to be complacent because transmission is lower, we do hope that folks can make use of easy access and short lines to get caught up on any missing vaccine or booster doses, and to take the time to learn about therapeutics now so that you'll be prepared to obtain quickly these life-saving medications should you need that treatment in the future. With that, thank you, and I'll take your questions.
Thank you so much, Dr. Freer. As a reminder, if you have a question, you may chat me, the host, or you may use the hand icon. Our first question comes from Stephen Scalzio from SCNG. Stephen, you're unmuted.
Hi, thank you very much. Hello, Dr. Farrar. I think you answered some of my questions already, but my question, but anyway, I'll ask some others if that's okay. Is the BA.2 variant, can you describe to me more about the BA.2 variant? Is it spreading more quickly and faster than the original Omicron or Delta? And can you give me an idea of the rate of that spread? And do you expect the BA.2 subvariant to be the dominant variant very shortly in LA County? And I'll just continue. My second question is, because people work in LA County, but they travel from, say, neighboring bordering counties like Orange and San Bernardino, do you expect the increase that you described of BA.2 subvariants to increase in those other neighboring counties where people transverse for work or entertainment and other reasons?
Yeah, thanks so much, Stephen. Both very good questions. Let me just start with, sort of BA.2. This is a variant that is, in fact, hard to believe, actually, more easily transmitted than the original strains of Omicron that really drove our, really horrific winter surge. The estimates vary significantly depending on the study, but somewhere between 10 to 15% to over 50% more easily transmitted. So that means, especially given what we've seen, that this will probably become the dominant variant here in LA County if it's not already the dominant variant. We do this sequencing, but we do have a 2-week lag on the specimen sequencing. And you've seen on that slide how rapidly we've seen the increase here in LA County in the specimens that are sequenced of BA.2. So yes, I think it will be dominant. I think it's probably already dominant, similar to what CDC found, across the entire country. They're estimating that it's somewhere between 70 and 80% of what we're seeing now in terms of infections are the result of people becoming infected with BA.2. I think there's some good news about BA.2. It looks like people who were previously infected with BA.1 or BA.1.1, that was what was dominating here in LA County and most of the United States and the world, frankly, are not likely to get reinfected with BA.2. It's not 100% that they won't get reinfected, but it looks like they're provided with some good immunity against this new sort of strain of Omicron. Remember, that wasn't the case for people who had been recently infected with Delta, who really ended up not having much protection at all from the Omicron strain. So again, that is some good news. I think the other good news is, to date, we've seen no evidence that BA.2 causes more severe illness. And we also haven't really seen a lot of evidence that it more significantly evades the vaccine protections. Again, it's early. We've got to pay a lot of attention to what the researchers are finding. We track information, obviously, from across the globe to help us with that. But so far, it looks like the biggest problem we're going to have is that it's more infectious. So if it's more infectious, the first thing to note is there are some people who are going to be at higher risk. People who are unvaccinated, not fully vaccinated, people who haven't been boosted, with their first dose for many, many months. They're sort of way out and have some waning protection. And people who have underlying health conditions, people who are elderly, people who are immunocompromised. These folks need to be cautious because they have an elevated risk. For some of those folks, getting vaccinated and or getting boosted will reduce that risk. But again, vaccines aren't perfect. They do provide us with decent protection against getting infected. They provide us with very good protection against a severe illness and death. But because they're not perfect, we also need to, particularly for people at elevated risk, we need to take some additional precautions ourselves, sensible things. You're in a crowded space indoors, put that mask on. We're recommending that everybody, continue to wear their masks while we continue to see the rate of transmission that's still occurring across the county. People use those test kits. Last week I talked a lot about, our ability to get test kits to so many people, and we continue to distribute them in some of our hard-hit communities. Grateful for our community partners on this. But use those tests. You got symptoms, please test. Go to a testing site if you don't have a test kit, because you don't want to be walking around potentially infecting others. We also know that from some early studies that there may be with BA.2 a higher percentage of people who are asymptomatic and infected or pre-symptomatic and infected. So again, I'm going to urge people, if you've had an exposure during that quarantine period, please keep a mask on, please get tested. Let's avoid unnecessary and completely preventable transmission wherever we can. I think I got your questions there.
Our next question comes from Ron Lynn from the LA Times. Ron, you're unmuted. Go ahead.
Hi, Dr. Ferrer. Thanks so much for taking our questions. Really appreciate it. Our questions today include a crystal ball question, a HRSA question, and a follow-up on all-cause deaths related to Latinos. So first, there's a lot of conflicting information out there on notes of optimism or pessimism when we think about BA2. There's an increase in cases in the Northeast, but some experts say they're not accelerating as fast as we saw with last fall's Omicron surge. Some have speculated that England was hit hard, maybe because they lifted mask restrictions too early. And there's some speculation we may be better off because mask requirements continued for a longer time here, driving case rates lower before they were eased. And here in LA, as you mentioned, test positivity remains low, but we're seeing an uptick in cases, more outbreaks in schools, and in Washington, a lot of politicians are getting infected. Are you pessimistic and concerned about a significant BA2 increase, or are you optimistic we might be spared an England-style surge, or too soon to say? Second, with the federal government no longer accepting requests for reimbursements to vaccinate uninsured people, is that affecting the ability of LA County to offer vaccinations and booster shots? And then finally, you mentioned the fact that Latinos are now dying from all causes at higher rates than white residents, which seemingly reverses what has been known before about the so-called Latino paradox. Can you elaborate more about the Latino paradox and how significant it is that we're seeing these trends of Latino death rates now surpassing that of white residents? Thank you.
Yeah, thanks a lot. Let me maybe start with the first question and try to take them in order. The crystal ball, I wish I had it. I don't, but I'm actually hopeful that we won't see the surge that we experienced over the winter, and for many of the reasons that you mentioned, Ron. First of all, we had well over 1 million people infected with Omicron. That's really well over 1 million people infected, and they have some natural immunity. We have, as I noted, 75% of the population fully vaccinated. We're getting more people to come in, fortunately, and start getting those booster doses. We've got a bunch of people that are eligible for that second booster dose. And, my hope is, again, people recognize, keeping your immune system as primed as possible, not a bad idea when you have a more easily transmitted variant that starts circulating. And we've got some therapeutics, not in the quantity that we need. We don't have the network yet that makes it super easy for folks to have access. But I think with the offering of a telehealth option, many people will benefit from being able to, again, prevent the worst outcomes should they get infected. So I am, hopeful. But I'm also like a realist, and I recognize that in that hopefulness, I'm also relying on the fact that LA County residents, for the most part, have really been doing their part to protect each other, and we're still going to need to do that. As we're seeing more outbreaks in schools, we have to take notice of that and not dismiss it and not fall so quickly into, I'm never putting that mask back on. I'm just done with this. Like, there will be times where it's going to be important to actually put a mask back on, and more important for some people than others. But in places like schools, if we, those schools that have outbreaks know, we start telling you right away, get those masks back on, because we want to do everything we can. Again, we're going to layer in protections when we need to. So, I hope that, with the great tools we have and people accessing them now, hopefully at higher levels than they did in the past, particularly around vaccinations and boosters and therapeutics, and our ability to go back and layer in some protections in those circumstances where it's warranted, we're going to be sensible. We're going to still be cautious. We're going to be acutely aware that this virus is unpredictable, and stay prepared and do our best to minimize the tragic consequences. So I am hopeful, however, that given what we've seen and what we're doing, we should be able to avoid a really big surge. But again, no crystal ball, no promises, just hopefulness that we can continue to do our part and keep ourselves from having a bad spring. In terms of vaccination and booster access affected by HRSA, not so far. We as a county are stepping in because it's super important that we have easy access to vaccines and boosters to make sure that, as you can see, we are not diminishing that easy access. I think that would be a big mistake at this point. I'll probably use this to make a plea to the federal government and our elected officials in Congress to understand that these dollars save lives on the ground. They make it easy for people to be able to both protect themselves and protect others. And during the middle of a pandemic, it's not the time for us to, again, be shortchanging our communities and their ability to do everything they can to reduce the burden of illness and death associated with what still, as you know, and this will go to the last question, is a very deadly virus, way deadlier than what we've experienced in any other virus, certainly in my lifetime. And I think it's appropriate to ask, what do we think accounts for this really dramatic increase in mortality for Latinos and Latinas in LA County? I think the first thing to note is that fully 70% of that excess mortality is directly attributed to people who died from COVID. And we just go back to who were the communities most at risk. Where do we have our essential workers? Where do we have highly dense communities? Where do we have more overcrowding? Where do we have less resources? Where do we have people individually with less resources to help protect themselves, to account for the gap we've continued to see in outcomes amongst Latinx residents, Black residents compared to other residents in the county. And I want to note that this held true even when we looked at Latinx residents that were fully vaccinated. And compared them to others, both fully vaccinated and those that were unvaccinated. And we saw that disproportionality in having a poor outcome around hospitalizations and deaths continued, even if Latinx residents were fully vaccinated. So that gets to the second part, that 30% that's not directly attributed to deaths from COVID, but does reflect, access to health affirming resources and chronic diseases. And, there's increasing evidence about the relationship between diabetes and bad outcomes with COVID, and then bad outcomes after you get COVID. And I want to note that the one area where Latinos and Latinas have had higher rates than others in the population, particularly than white and Asian residents, has been around diabetes. So again, I think what you're seeing here is the impact of not having easily available those what I call health affirming resources. I talked a little bit about what that is: protections at work, good paying jobs, secure housing, secure food that's healthy, access to good health care. We still have so many people that are hesitant because they don't have insurance, or they're here without all of their documentation to come in. And we saw, particularly in 2020, lots of people delaying their care, particularly acute amongst Black and Brown residents. So I think that helps explain why we've seen that dramatic devastation in the increase around all-cause mortality. We'll take the next question.
Our next question comes from Jackie Fortier from KPCC. Jackie, you're unmuted.
Hi there, can you hear me?
Yes.
Okay, thank you. Sorry, I'm recording, so I have a lot going on. You put a lot of emphasis on this, and I don't understand, so forgive me. You said the increase in outbreaks in schools is not associated with an increase in either test positivity or the number of cases. So are you saying that kids are not getting infected at school? If you could please explain what low test positivity at school means.
Yeah.
And then related to the HRSA money, how long can LA County, Health Department afford to underwrite vaccinations for uninsured people? Thank you.
Yeah, thanks for both. Let me start with the HRSA question. Not long. I mean, and I want to note that we have many generous providers that are also just, trying to make this work, but nobody can do this for long. So not a sustainable solution, and would be tragic if at any point there weren't free vaccines, free boosters available in this vast network we built that makes it super easy for people to go ahead and get vaccinated. In terms of the second question, your first question, it's a great question. I'm sorry if I wasn't clear, because I think it is the crux of the matter. Usually, you associate an increase in outbreaks with that increase that you see in cases. As a matter of fact, that's what happened during the surge at schools. We've never had a lot of outbreaks at schools since schools reopened this past fall. Never. As a matter of fact, I think the most outbreaks we've had in a week have been 24, and that was in the middle of this last surge. What they've been correlated with, the same thing with workplace outbreaks, outbreaks at SNFs, outbreaks in shelters, has been a dramatic increase in community transmission. And that's that test positivity rate. So when transmission is pretty high, we see big increases in outbreaks, and that makes a lot of sense. So what's worrisome right now is we don't have increases in community transmission. I mean, we've seen a small uptick this week, very small. We don't have an increase, but if you look at the data from schools on their testing, their routine testing, there's, much smaller numbers of on routine testing, people testing positive, super low test positivity numbers. So when you see the increase in the outbreaks, what it means is with those cases where people are positive, because we're always going to have that, there is now more transmission that happens in schools than happened in the past. And what that really means is some of those other layers of protection that really help mitigate against transmission in schools, because they're no longer there, make it easier for there to be transmission. So I know people hate those masks, or lots of people hate those masks, but those masks really helped keep transmission in those classrooms low, particularly because in some of our schools, the ventilation systems are less than perfect. And there's lots of improvisation to try to, circulate air more in classrooms. But those masks really, really help when you've got a person in your midst who's positive. You put a good mask on, particularly a respirator, something that fits well, that filters well. And even if there's a positive person in your vicinity, you're dramatically reducing your chances of getting infected. You're also, if you happen to be that infected person and you're wearing that well-fitting, high filtration mask, you're much less likely to infect anybody else. So those masks were helping. We don't have them everywhere anymore. Some schools, there's still a fair number of people that are wearing them. Other schools, not so much. It's really mixed. But as long as there are people not wearing them, it's going to be much easier for there to be transmission. Couple that with BA.2, I know for sure in this one large outbreak, it was fueled by BA.2, more transmissible, makes it easier for it to spread where there's opportunities to spread. So I think it's a great question, Jackie. Like if cases are going down, test positivity is down, why would we see more outbreaks? Well, it's because some of the other protections that we had in place are no longer there. And we're going to have to watch that because we all want our schools to be as safe as possible. We all want kids to be able to stay there and learn. We don't want there to be unnecessary illness associated with this. And we certainly don't want what we just saw, this super large outbreak in one school, more than 60 cases. I want to say that's one of the largest outbreaks we've ever had at a school since the beginning of the pandemic, at a K-12 school. So again, but thanks for the question. I think we just have time, maybe for one. Well, I don't even know. Is there one more question I need to try to get at?
I can give you one question that was sent in by Marla Tejas from Fox 11. Her question
I'll have to be the last question, though.
Yes, it can be the last question. Her question is, how important is it for 50 and older to get a second boost? And if you want to add it in, she wants to know what you make of the studies that show a second booster is starting to wane.
Yeah, I mean, the vaccines are waning over time. I think in part, that might reflect the fact that we've got a fair number of mutations that happen as well. But the reality is that the vaccine protections work well. They work best in sort of the earlier time periods after you get vaccinated and boosted. So I think that's just realistic. And it does mean that while these are the vaccines that are available, we're all looking at, needing to get boosted at some point. I think it's encouraging that researchers and scientists are working on different formularies for the vaccinations, but those are not likely to get approved for many months. So I would urge people who want to reduce their risk and they're eligible for the second booster dose to go ahead and get it. I think it depends on, your tolerance for risk. The evidence is clearest that over time, the vaccines wane in their protection, in particular in their protection from getting infected, but even over time in the level of effectiveness around hospitalizations. So if you're a person who wants to make sure you're optimally protected and you're over 50, and you're eligible 4 months out from your last booster dose, which was your first booster dose, go ahead and get that second booster dose. Our bodies use that boosted dose to boost our immune system, and that's helpful. This is particularly important for people who have underlying health conditions that put them at severe risk for illness, and hospitalization should they get infected. People who are immunocompromised really should be talking with their provider about the best sequencing. People who are elderly, and of course, I'm gonna use this as an opportunity to say, if you haven't gotten your first dose or you haven't completed your initial series, go right ahead and do that as well, because that will also give you the protections that these vaccines are offering. I know for people, there are some people who have said, I just got Omicron a couple of, maybe a month ago or 2 months ago. I know I have some natural immunity. That is true. I think the CDC is recognizing that that immunity also wanes over a few months. So people, again, you're a few months out from when you recovered from your infection with Omicron. Go right ahead if you're eligible and get that booster dose. So thanks for that question, Marla. And with that, thank you, everyone. We look forward to talking with you next week. If we didn't get to your question, just go ahead and send it in to us and we'll respond. So thanks a lot.
That's correct. If you have any additional media questions, you can send them to our media inbox at media@ph.lacounty.gov. Thank you once again for joining us today. And if you stick around, we'll have our remarks in Spanish in just a few minutes.